Shadow Health Minister Ros Bates is currently visiting medical centres and hospitals on the Darling Downs, and she joins me now on the side of the road, she says, between Chinchilla and Dalby. Good afternoon, Ros. Thanks for pulling over and taking the time to chat.
Good afternoon.
First things first, the long awaited COVID 19 vaccine has arrived in Australia, and the first immunisations are expected to begin very soon. Can we safely assume that people outside the capital cities, especially people in the bush, are a fair way down the pecking order when it comes to getting the vaccine, and that it's going to be some time before we get access to it?
Well, Harry, as you know, the COVID vaccines are about to be rolled out across Australia. And, I acknowledge that it's a massive logistical exercise, but the LNP want to see that the state government works closely with the Commonwealth government to make sure vulnerable Queenslanders have timely access to the vaccine once it's available. And quite frankly, your postcode shouldn't determine when and whether the vaccine is available to you or not. So, the state government should be making every effort to ensure that Queenslanders in rural and regional areas have access to the vaccine in a timely fashion like their city counterparts.
You're no doubt aware that yesterday the state government deputy premier and the treasurer were out at Wellcamp outside Toowoomba, renewing their calls for the what's known as the Wagner quarantine camp to be built just outside Toowoomba. There, what do you think of the merits of that proposal, and would you support a quarantine camp around Toowoomba?
Well, Harry, we know that there were some very basic problems in hotel quarantine. I mean, that report that came down about the Hotel Grand Chancellor clearly showed that even basic infection control protocols weren't followed. Now, we've always said that we want to make sure that those protocols are followed, and it shouldn't matter whether it's in a hotel, a hospital, a tent, or in a quarantine facility. We want to make sure that whatever problems occurred at Hotel Grand Chancellor isn't just transferred to another location. And we know that there is not much substance around the Premier's proposal. Even the Prime Minister said that it was pretty much dot point and was waiting for more information. And I think more importantly, the people out here in the regions, particularly in Toowoomba, need to be consulted so that they know exactly how this is going to occur if it does occur.
Alrighty, and the Deputy Premier, Stephen Miles, said that as recently as Friday, there was more detail provided on request to the federal government about the proposal. But we'll move on and see where that goes. You're talking to me today, Shadow Minister, from, as I said, the side of the road between Chinchilla and Dalby, but you're on a bit of a tour out to the Western Darling Downs, meeting with health professionals and catching up with people in hospitals and medical centres. Can you tell me what's the nature of your visit? What brings you out here?
Sure. Well, I'm accompanied by my Assistant Shadow Minister, Rob Mulhawk, who's the Assistant Shadow Minister for Mental Health and Drug and Alcohol Treatment. So there's some questions we'll be asking around that. We're visiting Chinchilla Hospital, and I'd like to see how the nurse-initiated model for low-risk births is actually being rolled out in Chinchilla. We know that under the Labor government, they closed down 34 birthing units in rural and regional Queensland since 2001. So it's really important to see how that model's actually working. We'll be visiting Dalby Hospital, the Goondier Health Services, and I'll also be speaking to local doctors and the PHN as well while we're here.
Okay, just on the maternity services, obviously over the decades, there's been a decline in the access that expectant mothers have to maternity services in outlying areas. What do you see as the problem here? Is it a funding thing? More money needs to be put aside to prop up these services, or are there efficiency problems and logistical problems that just make it too difficult in this day and age?
Look, I think Queenslanders deserve the world's best healthcare no matter where they are, and we need to make sure that rural and regional areas aren't, left in the lurch. We're still seeing babies born on the Warrego Highway, and that's actually on their birth certificate. So under the LNP, particularly under Lawrence Springborg, we opened up maternity units such as at Bow Desert, and we want to make sure that where it's safe, particularly where midwives can be used, that low-risk mothers can birth in areas such as Chinchilla. We've seen areas like Theodore with a closed maternity unit right now. So we're certainly wanting to see more of these reopened so that women across rural and regional Queensland can have safe births.
Another age-old problem, Ros, with rural medical service is the lack of availability or presence of of experienced GPs, experienced doctors to service their medical centres and their hospitals. Certainly in Chinchilla, there are two long-standing GPs who perhaps aren't going to be around for all that much longer. I know up in Bowen there was a similar situation where there was a retiring GP with 3,000 patients, and he just simply couldn't find anybody to come and take up the mantle. So it's, I'm sure, an example of things that are happening all over the place. It's getting harder and harder to attract country doctors, so they're supplemented with locums and registrars. Do you see that as a problem, the trouble in retaining doctors, and what do you think could be done to help attract doctors to stay in more permanent terms in outlying areas?
Absolutely. Well, I mean, we know in areas like Hughenden, they didn't even have a doctor for 18 months. So we need to make it more attractive, not only for the doctors, but for their families to want to come out here, because it's not just the medico who's moving out here. They generally have a family, a wife with, a husband with kids. So finding suitable accommodation for them is really important as well. We just need to work more closely with the Rural and Regional Doctors Association to make it more attractive and to fund so that we can not only get doctors out here but make them want to stay.
Alrighty, and I know part of your tour tomorrow is to visit aged care facilities in Dalby. What's the plan there? Is there anything that you're particularly interested to see in your role there as Shadow Minister for Health when it comes to aged care service delivery in the bush?
Yes, well, I mean, we saw, last year or the year before, the horrible issue that happened at Earlhaven, which was a state-run facility, a federal-run facility, and at the time I asked to visit all 16 state government-run nursing homes, and I'm still waiting for that request to be fulfilled. So it's good that I'm actually getting out to Dalby, obviously to make sure that services are enough for what they need out here, but also to talk about the rollout of the vaccine, because nursing home patients and their staff are indeed the most vulnerable and will be the first to be involved in the rollout.
We'll let you get back on the road, Ros. I appreciate you pulling over and chatting to me there. Appreciate your time and enjoy the rest of your visit out to the Darling Downs, and safe travels on that Warrego.
Thanks very much, Harry. Nice to speak to you.